I've adjusted her. Exhale for me all the way out. Good, other side. All the way out. Nice. And this one all the way out again. Just back your shoulders. Okay, here we go. So we have Alicia in the office. We are working on, we're gonna have full spine adjustment, but she originally came in with rib pain, bilateral thoracic pain between her shoulder blades, along her ribs. It's a pretty common problem we see. It's a very difficult problem to fix because, you know, you have your ribs and then you have your intercostal muscles and nerves that run between your ribs. So it's something that can, you know, really be a sticking point for people and hard to fix. Okay, so we're just starting with some soft tissue work along her thoracic paraspinal muscles. So here's her thoracic spine, more along the midline, and then just lateral to that are where the rib heads meet the thoracic spine. And then we have the shoulder blade. And so sort of right in through between the shoulder blade and the midline of the spine is where that rib head becomes inflamed. So we see this a lot. I don't even know what you do for a living. You don't have to tell me now, but people who, and you can in a second, people who work at a desk, yes. People who are at a computer screen, people who, you know, drive for a living, and where your shoulders get rounded, your head's forward. We see a ton of this in the office. Really, where our curve in our neck should be back like a C, and our shoulders should be back. But the reality is, it's tough to stay like that when you have a job that makes you're always forward. So you see a ton of this issues here, and people just, you know, take medication, but then you're gonna end up with a really rigid, you know, almost scar tissued over, decayed thoracic spine. So, you know, you're absolutely better off coming in to get that adjusted and worked on. It's gonna keep your spine healthy over the long haul. Go, what were you gonna say?
I was gonna say cybersecurity.
Cybersecurity, yep. So we talked about that, yep, yep. So hours and hours. Think about all the hours that add up over the weeks and months and years that people put in the computer screen. Deep breath in, let those arms relax. Exhale for me all the way out. Good. And I've adjusted her so much that I know she actually moves better face up, but we'll get there. Now we're in the lumbar spine, and there's 5 lumbar vertebrae, and we're just contacting the transverse process of each lumbar vertebrae. I'll show you the spine and show you. And we're just dropping posterior to anterior, T to A with the drop. And then we're on the sacrum. So we're motion palpating, we're feeling for alignment all while we adjust. She's really tiny through here, so we're going to do some soft tissue work on her low back. So just some light soft tissue on her lumbar spine. Another common problem we see in the office is this SI pain people get, where your QL muscle comes down and meets your ilium. And anytime there's some SI misalignment, it really causes a buildup of inflammation right through here. So the drop work is great for that, and the muscle work. If you let it go, it could progress into sciatic pain down the leg, nerve pain. Just had a guy today who can't feel his foot, can't lift his foot. He probably had sciatic pain for years, brewing, developing, never did anything for it. And you know, the nerve now is basically shot at this point. So you got to come up with this stuff. Okay, go on your side, facing me. Okay, here we go. Very good. Deep breath in. Exhale for me all the way out. Good, other side. Okay, deep breath. Exhale all the way out. Nice, face up. Sorry, Ashley, come around this way again. Cross these arms for me. So right along her spine and the rib heads. Got a deep breath. Right back down on my hand, drop. Good. This one. Perfect. Last one. Excellent. And let's get the neck adjusted. Okay. Just relax your shoulder. And this one all the way out again. Just relax your shoulder. Perfect. Excellent. Hang on to the table. A little with the leg. Pull each leg. And this one. Okay, so we'll do a little more soft tissue, but that's the gist of her adjustment. Thank you very much.
Thank you.
Face